Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is an EpiPen?
An EpiPen contains the medicine epinephrine, which is the medicine we use to treat anaphylaxis. So anaphylaxis is a life-threatening reaction to some form of allergen. Could be a food you ate, a medicine. So the EpiPen delivery system gives you that epinephrine in an emergency. There's many other forms of these injections.
With the cost of EpiPens becoming unaffordable for many families, what are the alternatives?
There are several options, including a branded formulary and a generic. The Adrenaclick autoinjector, and then there's an epinephrine generic autoinjector. They contain the same medicine, the epinephrine. It's a different injector, so you want to make yourself familiar with what you have and practice with it.
What's the cost difference between an EpiPen and the generic version?
Some of the generics are probably half the cost of what the EpiPen delivery system is. You also may find that there's available coupons or other patient assistant programs, depending on which brand is preferred by your insurance company or if you're self-pay. EpiPens should be stored at room temperature, so that's definitely something to pay attention to. You don't want to store it in your car, you don't want to freeze it, so keeping it somewhere where you'll have easy access to it, but it's not getting excessively hot or cold is really important, making sure the medicine will still be working. You want to keep it somewhere where it'll be protected from direct sunlight, and so that it's not getting excessively hot.
What is the proper way to use an EpiPen so medication is not wasted?
If you think your child or family member is having a life-threatening reaction to an allergen like anaphylaxis, they might be experiencing hives, they might be having swelling of their mouth or their lips, they might be complaining of trouble breathing, there might be vomiting, so there could be lots of different symptoms that would indicate anaphylaxis. At that time, you would want to administer the EpiPen. So you would take off the cap, follow the directions on the injection system that you have, and take the EpiPen or other delivery system and put it right into the thigh and hold it there for about 10 seconds. Then you want to remove it from the thigh and massage the area. It's really important to note that if somebody is having an allergic reaction, you use epinephrine, you need to call EMS right away. They need to be transported to an emergency room for ongoing care.
When does a child outgrow EpiPen dosage?
That's a good thing to review when you meet with your doctor. So the lowest dose EpiPen is for children up to 66 pounds. Once they go above 66 pounds, they should be going to the higher dose injection system.